about diversity. I'm actually going to hand this over to Dr. Winters. This is a critical piece because I think a lot of people, right, Dr. Winters, want to make the feel-good argument. It should just be about quotas and there should be more of us in medicine, but that's not the reason why we're here tonight, right?
I agree wholeheartedly, and welcome everybody. It's a pleasure to be here and to talk with you as well. My name is Dr. Tyree Winters. I'm an osteopathic physician, but I'm also trained as an academic pediatrician, meaning that I teach teach students about pediatrics as well as my residents as well. I'm a program director, so by the time it goes into specializing in a residency, I'm one of the people that pick you to come into the wonderful world of pediatrics. So to talk about why diversity matters and why it's important, especially in all fields of medicine, is because of the fact that we know by research that minority physicians, dentists, podiatrists, ophthalmologists, optometrists, we all tend to work in communities that look like us and that serve individuals who not only look like us, but also may be underserved. They may also be sicker patients. And then we know that also our patients tend to trust people who look more like them. And so when you can develop a relationship with your patients and being able to not only represent them as they see themselves, but also being able to represent a specific need within that community, it makes a huge difference. And it makes our patients want to come back and trust us, especially as we're seeing now with the current epidemic that we're having, or pandemic that we're having, where we see that certain communities are being targeted more. Also, when you look at minority dentists as well, the one thing that you can find is that minority dentists tend to work in more minority communities and are able to, as you will find out from Dr. Young as well, that these dentists are more likely to be able to help our communities who may struggle to be able to provide dental care in certain areas. Next slide. So what we find is we see not only is it an increase in the amount of patients that we're able to serve that look more like us, but there's also a sense of being able to have a better physician, provider, and patient communication. So you typically will find that patients will be able to ask questions that they may not feel comfortable to ask to some of our other counterparts. And then we all have experienced this, all of the mentors have, where we walk into a room and we may come across a patient who may be a older individual within our community, and the first thing they say is, "It is so good to see you, and I'm so happy that I'm able to see someone that looks like you." It makes a huge difference, and it provides us with a sense of not only responsibility that we have for our communities, but it also provides us with a sense of pride. And so